I'm curious how you as a doctor manage your own mental health. And what I'm not asking is for a rundown of any kind of mental health problems you may or may not have. I am curious, though, what it's like to see people suffering and still want to go to work. I know how I do it, but it's different because you see physical suffering.
Um, I would say as a whole, doctors don't do a good job, and I'm guilty of it too. I mean, I can think of a few times in residency after uh, pretty gnarly codes where like every chest compression is just blood shooting out of the person's mouth, or after another time where I had a patient of mine that we had delivered. We'd been laboring with her for it was a preterm delivery, and uh, anyway, she ended up bleeding out essentially during the cleaning out of everything, and like that, I feel like after that I was pretty traumatized. Like I know like I was felt like I was on an adrenaline rush for, but it wouldn't calm down for at least a week. Um, and so in residency, we're kind of taught though, I mean, like that code that I described, I was on call, get called up to that, and then immediately have to go down and admit someone for something completely benign that ended up not being anything. And it's like you don't get any time, at least during training, to sit and process that. And I think as a whole in medicine, we just kind of, well, move on to the next one, um, and try and forget it. But I've been trying to, at least when things do linger with me, I try and figure out why is that lingering with me? Like what is hitting me so hard about that? Um, and so uh, I'm not ashamed to say that I've been to therapy. I have my own mental health issues that I struggle with. Um, and so I think in answer to the question, like, how do I handle it? I try and, as much as I can, leave work at work, um, and try and, as much as I can at least, be at home and be present at home and appreciate my kids and everything, especially after seeing some of like the truly horrendous things that have happened uh,
So
to,
it sounds like
to
from
kids.
even the beginning of your training, you were trained to compartmentalize. Like this death of someone on your table happened in that room or at that time and is not at all related to the next person. You have to admit there, and you like mentally section those things off. And so you do it between work and home, you do it between patients, you do it between floors of the hospital. Like you just are putting things in boxes and they stay in those boxes. That's my
Yeah.
perception of what's happening.
Hmm.